Well, good morning to some and good afternoon to others. My name is Bonnie Howard. I'm a senior fellow with the Campaign for Grade Level Reading. I'd like to welcome you to GLR Week 2024. We are looking forward to a week of learning and sharing. This session, Ready, Set, Go, Two-Generation Approaches to Kindergarten Success, is the first of a great lineup of conversations. We're delighted that you've chosen to spend your time with us today. For this session, we've pulled together an impressive panel comprised of national and local leaders to guide our discussion. They're on the front lines of policy and practice and bring a wealth of expertise and experience. We hope you'll leave this session with a deeper appreciation for the value of two-generation approaches for early learning success, because what we know is that when a child starts ahead, they stay ahead. But sadly, the converse is also true. The other thing we know is that school success involves not only the child, it also engages first and foremost family and caregivers, schools, and the community. Our colleagues from the Minnesota Department of Education remind us for the need of intentionality around language and point out that it's the adults in children's lives that need to be ready. Minnesota's successful learning equation recognizes 4 interconnected components that foster successful learners. Ready families establish the foundation for their child's health, development, and learning within the context of their family's cultural values, norms, and beliefs. Ready schools and programs deliver high quality, developmentally appropriate, culturally and linguistically responsive care and education. Ready communities offer services to enhance the health, safety, economic stability, development, and learning of children and families. And Ready states and Ready systems provide equitable access to comprehensive services and resources. The successful learner equation reminds us that it's not the responsibility of the child to be ready for school, it's the responsibility of adults, programs, and systems that support children's success. Children come to us full of wonder, energy, and trust. They are ready to be successful. And with that, I'm going to introduce you to our lineup of speakers for this afternoon. We're lucky to have with us an expert in this area to moderate our discussion, and that's Marjorie Sims. She's the Managing Director of Ascend at the Aspen Institute, a convener for diverse leaders working across systems and sectors to build intergenerational family prosperity. Marjorie has more than 20 years of experience in advancing the status of women and families at the local, state, national, as well as international levels. And our panelists today include Iola Fortune, who's the Vice President of Impact at United Way Worldwide. She provides oversight, strategic guidance, and support to team members managing key initiatives in education, economic mobility, health, human trafficking, and disaster relief. She leads efforts to support local United Ways to advance equitable community impact by developing frameworks, strategies, peer learning, and training opportunities. Rowena Naidoo is Vice President of Policy and Community Initiatives at Mile High United Way in Denver. In partnership with nonprofit organizations, her work focuses on using social justice strategies to provide communities with access to opportunity. Rowena leads the organization's policy initiatives to address systems challenges. Pam Romero is the Vice President of Community Schools with United Way of Chattahoochee Valley, where she leads the educational equity strategies through implementation of Community Schools United. Pam launched the first community school strategy in the Chattahoochee Valley, which has grown into 4 schools across 2 states, both Georgia and Alabama. Jennifer St. John is Vice President for Impact at United Way of Chattahoochee Valley and has served United Way for 26 years in progressively responsible roles. She's committed to the United Way's mission and strives to use her knowledge, skills, and values to make positive impact internally as well as externally. And finally, we have Vivian Sen, who is the President and Chief Executive Officer at the Foundation for Child Development, a private foundation that works at the nexus of research, policy, and practice to advance equity and justice for young children and their families. She is widely recognized for her leadership role in building an interdisciplinary field of research, expanding research practice partnerships, and supporting a broad movement to democratize evidence. I'd like to welcome all of you to GLR Week and to this session. We look forward to engaging with you and learning from you. And with that, I'm going to turn it over to Marjorie to get our conversation started.
Wonderful. Thank you so much, Bonnie. Ascend at the Aspen Institute is deeply honored to be in collaboration with the Campaign for Grade Level Reading and United Way Worldwide on this series of webinars. We, as 3 entities at the national level, have a shared North Star. We're focused on expanding family prosperity and stronger communities. For Ascend, we believe in radical collaboration. By working together, we climb higher and go further. We center the voices and recommendations of families, and in the last 10 years, the Ascend network has grown from 58 inaugural network partners to close to 600 nonprofit organizations in all parts of our country and now in 3 other countries. We are a large community of practice and innovation about 2-generation approaches. I call it the coalition of the willing. People who, like all of you joining us today, already know that our systems and policies are siloed and are failing families. Our collective work is to reimagine those programs, systems, and policies, and to use a 2-generation or whole family approach. Simply put, 2-generation approaches build family well-being by intentionally and simultaneously working with children and parents together. The concept, as many of you know, of supporting the entire family is inherent in Indigenous communities here in the US and around the globe. The Foundation for Child Development, joining us today, actually coined the term 2-generation approach in the late 1980s, when they noticed that early care and education programs were beginning to expand their services to support the parents of the children in their programs. Since then, we've learned a lot about why 2-generation approaches are important for families, also how to implement 2-generation approaches within community-based organizations, within county and state agencies, and across communities and across multiple agencies at the state level as well as at the federal level. We also know and have learned over the years that families determine for themselves the structure of their family. Last year, we were honored, again, in collaboration with the campaign and United Way Worldwide. We hosted 3 webinars about 2-generation approaches within the United Way community. We'll place a link in the chat to those webinars because they contain strong examples of why and how of 2-generation approaches. But today, we're really excited to share information and examples, as Bonnie noted, about why 2-generation approaches are critical to kindergarten success. And I want to emphasize again what Bonnie shared, that we are intentionally using the term kindergarten success to reframe from kindergarten readiness, to place that emphasis on the many systems and policies needed to support the success of all children. As she said, children come ready. We need to be ready for them. And we'll share more about all of these strategies during our conversation. But now I'd love to welcome Vivian to share the work the Foundation for Child Development is doing to ensure that both programs, policies, and resources support kindergarten success. So Vivian, welcome, and thank you so much for joining us today.
Oh, thank you, Marjorie, for that very warm welcome. And I just want to thank Bonnie, Marjorie, and everyone at the Campaign for Grade Level Reading for putting together this wonderful series and for inviting me to be a part of it. And thank you, Marjorie, for calling back to the Foundation for Child Development's history. And indeed, I'm so privileged to be part of a foundation that has long recognized how important it is to think about children in the context of their families, because too often we have been in situations where folks are focused on the kids, but without that very important family context. And so I feel so privileged to be part of a foundation that has for a very long time really recognized that. My own history of the foundation is much more recent. So I started at the Foundation for Child Development a year and a half ago. And what I thought I would talk a little bit about today is how we're thinking about these issues of two-generation approaches to address inequality and gaps for young children in today's moment. Because I noted that one of the themes for this week is thinking about today's moment. And like many of you, I've been thinking about this in relation to the things that have happened over the last few years in our country. And it can be quite discouraging to look at the state of affairs. And so as I was thinking about this and coming into my role, I was thinking about what the Foundation for Child Development could do in this moment to really make a difference for young children and their families. And one of the core problems that I was wrestling with is that our country has had a chronic underinvestment in young children. And we can think about the ways it shows up in lots of different ways across policy areas, service areas, in terms of the people who care for our young children. But the overarching problem is there's just this chronic underinvestment in young children and their families. And I was pondering whether there was a way into this problem. Is there hope for us and for our country, given the state of our underinvestment? And that launched me into a conversation with Olivia Golden, who many of you might know is just this wonderful experienced policy advocate and policy maker about that. And I was asking her, is there a way into this problem? And she actually said to me, well, actually, Vivian, if you look at the massive number of policy reforms that were passed in 2020, 2021, you can see that our government actually did launch large-scale investments in young children and their families. And in fact, what a success story, because that set of policies effectively reduced child poverty in half. And it didn't do it over a decade, because in 2019, there had been this National Academy of Sciences report that talked about coming up with ways to reduce child poverty in the course of a decade. But actually, these policies that were passed in 2020, 2021, effectively reduced child poverty in half in just the span of a year or two. So that's really remarkable. And so together with Olivia, we set out to try to understand what were some of the lessons learned from this large-scale investment in children and families, because it was such an extraordinary departure from our nation's history. And it was such an extraordinary departure in a number of ways. One, it was an investment in multiple areas that affect children and their families. So there was concern around families' economic stability. There was support for employment, for housing, for nutrition. And as a developmental psychologist, and as someone who works at the Foundation for Child Development, the importance of these multiple ways of caring for young children and their families, it's not at all a surprise, because those of us in child development know that children are affected by all of these things. If we take a whole child approach, all of these things matter for young children. And then another way in which this large-scale investment was different from the preceding policy history is that it focused on entire service systems. So, for example, if you think back to the childcare industry, which was in danger of collapse, we were in very harrowing times. And that moment, the federal government put in $50 billion in investment in the childcare system. So unprecedented. And then a third way in which I think this was an extraordinary time was that the policy reform was so inclusive. And I'm going to come back to that and talk about the ways in which the policy was designed and implemented so that it was inclusive of different groups of families. And I think that's another important part of this success story. So in a time when we need some success stories to keep us going, we set out to learn what were some of the lessons learned from this remarkable set of policies that were passed that did so much for young children and their families. And when we approached this, we knew that we wanted to learn from organizers, advocates, and coalition leaders that really worked on the front lines of making this policy change possible. And you can see here a slide with the cover of the paper, as well as the 5 key lessons that we pulled out. And the reason we wanted to really call these lessons from organizers, advocates, and coalition leaders is because we were interested in how do you make a change like this happen? And we know it doesn't just happen on its own. We knew that there was a lot of groundwork laid for these reforms that were laid over many, many years, and that it didn't just happen in a moment. And we knew that there were people working on the front lines to seize opportunities, or even more so to create opportunities in those early COVID days to push through these policy reforms. And so we really wanted to come in and focus on those folks. And I can tell you that having generated these lessons learned, I really think of these as the sheroes of our times. And that there's so much we can learn from many of them women on the front lines of making these policy reforms happen. And so I'm not going to go into detail on all 5 of these lessons. Instead, I'm going to try to zero in on just a couple of them. But just to give you a sweeping sense of what we learned, we put them into 5 categories. One was the importance of centering families with lived experience. So this is about putting the families that are closest to experiences of injustice at the center of our thinking, our policy advocacy work, our policy design work, and thinking about policy implementation. A second lesson learned revolved around expanding coalitions to engage families, care workers, and allies. So building stronger coalitions that are capable of exercising power to make these kinds of changes. We also learned lessons about the importance of building federal and state strategies to achieve equity, that this is a bidirectional relationship and how important that is. We learned lessons about the need to strengthen coalition infrastructure so that folks can work together in some united pathways. And then 5th, we learned lessons about sustaining long-term efforts. So let's pull down that slide. You can see there's a link to it, and I believe that Emily will be posting links to the paper for anyone who's interested. But let me talk a little bit about just 2 of the lessons learned, which I think are particularly poignant to me, and I think for this webinar as well. And one is just the importance of centering families with lived experiences who are closest and most impacted by the injustices of our society, and how important it is in these reform efforts that we really center their lived experiences. And it's important for many reasons. It's important for moral and ethical reasons. It's also important for just practical reasons. If we look at who children are today, over half of our child population are children of color. So when people are talking about, planning for the future and this demographic change that's happening, well, we don't really have to wait for that to figure out what that looks like. We just have to look at our young child population. They're already majority children of color. And a part of the reason we've had this major demographic change is because of immigration. And so we also really need to think about children in immigrant families. 1 in 4 children in our country have immigrant parents. And so it's so important as we think about inclusive policy reform to also focus on these children. And what's, I think, so important about this set of policy reforms that reduce child poverty is that all of these children benefited from the policy reform. So child poverty was not just cut in half overall, but it was also cut in half for children of color, for Black families, for Latino families, for Indigenous families, for Asian American families. And children in immigrant families also got to partake of these policy reforms, more so in the later renditions of the policy reforms. But increasingly over time, they were also able, children in mixed status families were also able to benefit from these policy reforms. And so we have here an example that when we are intentional about it, our policy reforms can benefit all children. And that we do not need to sacrifice one group of children's welfare for that of another group. We are capable as a country of caring for all of our children. And so I think that's really important. We have to do it intentionally, though. We have to really center the lived experiences of those families so that we design policy, implement policy to reflect what they care about, what their needs are, what their priorities are. That's the first lesson. I'm now going to jump ahead to the fifth lesson from our paper, which is the importance of sustaining long-term efforts if we want to see these massive changes for young children and their families. You know, I've so far been telling a success story, but a success story in some ways of a moment in time of those 2020, 2021 COVID era policies. But it would be a mistake just to look at it as these efforts in those two years, because really those successes built upon a much longer term effort. Efforts that were happening at the local level, progress in parent organizing, progress in creating solidarity between parent organizers and the care workers for young children, progress at the state level, state advocacy efforts that led to being able to make a stronger federal case for some of the policy reforms. And it's so important that we kind of have this longer time horizon and we can look back and understand all the things that enabled the success that we saw in 2020, 2021. And I want to really hone in on this importance of a long-term view, because too often I think we become focused on a moment in time, and particularly whether there's been a policy win or a policy loss in a moment. And that can really hinder all of us because we don't fully appreciate all the work that has to go into building up the possibility of change. And so that leads me and my colleagues to think a lot about the ways in which we need to reframe what are wins and losses. And to consider that even when we lose a vote in a legislative session or in an election cycle, you can think that community power that's built over the course of a campaign can actually be a win for a longer term agenda. And that the relationships and coalitions that are built along the way provide strength for the movement in the long term. And so how valuable it is to really think about those things even as we're working towards transformative change. And then that's looking backward, but when I think about looking forward, I think about how important a long time horizon also is. Because as I've been talking about this as a success story, but of course this is an unfinished story, because many of you are probably thinking, yes, there was a big dip in child poverty, but as soon as those policy reforms lapsed, child poverty spiked right back up again. So it was a temporary success story. And so we should be really thinking about how can we build up the momentum for change like this again? Because it is possible. Our country has done it before. And I'd like to think optimistically that it is possible to do it again. But we have to be intentional about it. We have to be smart and strategic about it. And then what I would also say is make sure that they are not temporary the next time around, that they are sustained changes, but also in the next time we go at it, that we really think about gaps too. Because while I talked about children of color and children in immigrant families benefiting from the policy reforms in the sense that there was also a drop of over half in child poverty levels, the gaps remained. So there were persistent racial gaps in poverty, even though poverty declined for those groups. There remained gaps between children in immigrant families and in US-born families, those gaps remained even though all families experienced a decline in child poverty. And so we should be more attentive to those gaps as we think into the future. And I also, because I'm a funder, I want to offer this up for my fellow funders in the audience, which is how important it is for our role to also sustain our long-term commitments and long-term agendas. Knowing that if we are constantly shifting our gaze and looking for the policy win, in the moment, we can be shifting our gaze and the work of people in the field away from the long game and success in the long game. So those are my remarks, and I'm happy to pass it back over to Marjorie.
Thank you so much, Vivian. And I hope that everyone reads your new paper, Cutting Child Poverty in Half, because it is such a wonderful resource. Not only the 5 recommendations that you shared, but all of the examples and the specificity. And one of the things I'd love to just share with you, and I'm going to put a link in the chat, to the 5 core principles when taking a 2-generation approach, because they completely align with the 5 recommendations and lessons that you're sharing. And especially the first one around centering the voices and lived experience. And the last one around, sustainability, because making certain that we're measuring and learning from the successes and pointing to those successes is really important. But just a quick question for you. And the centering the voices of people with lived experience, did you come across any very practical examples of how organizations are doing that really well? Was there one strategy or one effort that really stood out for you?
Well, the one that stands out for me is Parent Voices California,
Mhm.
because, so they're a parent organizing group in California. And so as part of being a good parent organizing group, they were on the ground very, with their families and really understood what are the priorities of families when it came to childcare. And they knew it was about the fees. It was about subsidies because they knew their families so well. And so when the federal money came into California, they already knew what's the priority for our families? What do they care about? And so they successfully addressed that with the federal money. And then when the federal money lapsed and it went away, because they'd also been building all this grassroots strength among their families and they knew what mattered to them, they were able to advocate in California for that ongoing support and to get the increased dollars for it from the state. So I think
Wonderful.
this is such a great example of investing in that grassroots organizing in the long term is a great way of ensuring that the things that parents care about are really at the center of the advocacy agenda.
Wonderful. Thank you so much for that example. And again, I'm encouraging everyone, joining us today, really take time to read the report. It is a strong demonstration how when we invest in children and their families, we do have very strong results. So now I would like to ask Iola to join the conversation, and in your role at United Way Worldwide, looking at strategy and impact and innovation, would love to hear from you some of your thoughts and examples, information you'd like to share about why supporting families holistically is important to achieving your goals. So thank you, Iola.
Thank you very much, Marjorie, and welcome everyone, especially to my local United Way colleagues and the many school and community partners joining us today. My role on today's call is to set the broader context for the specific local United Way efforts that you will hear about later on today's call. I've worked at United Way Worldwide for the past 15 years, all on the impact team. And just for those of you who may not be working with your local United Way or familiar with our network, United Way is a global network with close to 1,000 United Ways operating in 36 countries. We collectively work to mobilize everyone in community to ensure that we help to create more resilient communities where everyone can thrive. And for us, that means working to address the core issues, especially in health, education, and economic mobility, to ensure that all individuals and families can thrive. And I'm so pleased to be joining you today to set the context and share a little bit more about the role that United Ways play and the work that we do to advance kindergarten readiness and success, often leveraging two-generation and other strategies to ensure that children are ready for and have success in elementary school that sets them up for success in the later grades and ultimately college and career. Next slide, please. A little bit about our impact approach. United Way, we work on education, we work to address economic mobility and health because we know that these issues, and you heard it in Vivian's remarks as well, are fundamentally interconnected in our everyday lives and in the lives of the people that we serve. People who are healthy are more productive workers. Students who are healthy are more likely to have regular school day attendance. People who have access to education are more likely to be able to maintain their health and that of their families. Families where at least one wage earner has benefits like health insurance are more likely to have sustained regular access to quality health care. So we work in specific issues deeply, and we also adopt holistic, integrated approaches in many communities because we believe the solutions need to reflect the realities of the lived experiences of the people that we serve. We go to the next slide. That ability to bridge and work across issues comes from deep knowledge and experience working within each of these spaces. So what you see on this slide are the most commonly employed strategies that local United Ways are advancing in their communities. In the area of youth opportunity, which encompasses early childhood, K-12, and some form of post-secondary education or credential, local United Ways are most commonly engaged in ensuring access to high-quality early learning environments. This includes increasing access to early childhood programs, leveraging resources like Born Learning to create additional early learning experiences, ensuring program quality across all settings, including informal and formal daycare and early childhood settings, and advocating for increased resources. Local United Ways also work to increase literacy supports by increasing access to books in the home, providing reading programs during the summer months when children are out of school, engaging volunteer readers in the community, and providing additional support, either individualized or group settings, for struggling readers. And family engagement, which you also heard about in terms of making sure that we center those with lived experience, we do that as a network. It is a core area of the work, especially ensuring families have the resources and the tools, the networks, and the opportunities to support their child's learning and development, providing learning opportunities for parents and caregivers, and family engagement activities in partnership with schools. Next slide. And so if we look similarly in the area of financial security, which I'm using interchangeably with economic mobility, we work deeply in this space as well. Local United Ways are most commonly working to increase access to well-paying jobs, supporting workforce development initiatives, increasing access to vital financial services like access to lines of credit and affordable savings accounts, free tax preparation, and thirdly, increasing access to affordable housing. If you have lived experience or know firsthand the destabilizing impact of poverty, then you know that families that are financially stable better ensure that the children in them can thrive and develop a stronger sense of stability and well-being. Next slide. That deep work that I just talked about in those specific areas informs and serves as the bedrock for the role that local United Ways play in addressing these needs more holistically, which you see on this slide. Our work, for instance, in early childhood started with Success by Six as a collective effort, which was a national and local public awareness and advocacy campaign combined with local collaborative action, including family engagement and resources for family members and caregivers. All of this was designed to increase the awareness, the collective awareness regarding the importance of early childhood development for lifelong success, to leverage policymakers, the business community, nonprofits, the early childhood community to ultimately transform our collective understanding and action related to the importance of those early years and the need to create systemic supports and access to early childhood programs. That foundation is reflected in the present day. So if you look at our network now, United Ways show up in many of the other well-known initiatives that are focused on strengthening children, youth, families, communities, and schools, some of which you see represented here. We are boundary spanners. United Ways are able to work across settings and with diverse sectors to identify and implement shared solutions. And this is how I think of the work of grade level reading, the campaign which we've been involved with for over a decade, community schools, where we have 114 United Ways working in that space, leading those efforts and supporting them, cradle to career efforts like Strive, and 2Gen efforts, including the work that the Seymour Foundation has historically supported in our network. In that work, as you see on the left, local United Ways play multiple roles, and I'll call out most notably the convening role, bringing partners and stakeholders to the table and simultaneously centering the voice, as Vivian shared, of those with lived experience, but aligning and coordinating efforts to ensure those with the greatest needs receive the greatest array of supports. And I'll say more about that in terms of Vivian's remarks in noting that while increasing the child tax care credit cut poverty in half for all families, it didn't close the gap. And what that tells us, and what an equity-minded approach tells us, that people are differently situated in their starting point. And so we must differentiate the supports and services, in some case, add more supports and services because people are starting further behind. And if we don't pay attention to that, we may make progress, but we will not close gaps. And so that's a really instructive lesson learned in terms of the importance of having an equity mindset around these issues. The other roles that United Ways play in this space are making sure that we're developing goals and strategies so we can be systemic and multifaceted in our approaches, raising community and stakeholder awareness, making strategic resource investments, and collecting data so we understand where we're making progress and where more change is needed. This is the kind of work that holds the best promise for long-term systems change that Vivian referenced earlier in her remarks. And you'll hear these elements as you hear our colleagues at United Ways in Chattahoochee Valley and Denver, who reflect on their work in today's call. And so it's my pleasure with that to transition back to Marjorie, who will introduce our local colleagues.
Thank you so much, Iola. Really important to see the work that United Way Worldwide is doing across the country in support of, communities across the country. So thank you for that. I would love to now hear from the local United Ways and hear about their strong, partnerships and work and outcomes that they're having based on, taking a two-generation whole family approach. We know that it's both in practice as well as in systems change and policy and across many platforms. So I'd love for Rowena to join us now and share about the work that she is doing with her colleagues at United Way Mile High in Denver. So thank you, Rowena.
Thanks, Marjorie. And thank you so much for inviting Mile High United Way to this conversation. I'm going to start with a little bit of background. In case you didn't know, Mile High United Way is the very first United Way in the world. This incredible movement started here in Denver in 1887, all thanks to a courageous, remarkable woman named Frances Weisbart Jacobs. She's also referred to as Colorado's Mother of Charities. And she was responsible for starting Denver's very first free kindergarten. So a dedication to early childhood education is very much part of who we are. So we're going to go to my slides now. And on the first slide, you can see that in Colorado, we're fortunate that our Department of Human Services has as one of its initiatives a two-generation approach to guide our state services. According to the state, when programs and policies are designed with the whole family's education and economic future in mind, and families are assisted to reach the social networks and resources that they need to be successful in life, opportunity becomes a family tradition. And I love that. Opportunity becomes a family tradition. And when we're successful in implementing these two-gen strategies, as you can see on the slide, our families will have their basic needs reliably met. They will achieve economic security. Our families can prepare for educational success from pre-K to post-secondary. We can build family supports and social or community networks. Child development is cultivated, and the whole family will achieve safety, health, and well-being. And all of this really helps set the stage for how we support families. And I'm going to focus on the early learning space. So on this next slide, you can see that here are the gaps. These are the gaps. These are the growing needs that are affecting our families. So Colorado's economy, like all of our economy, really depends on working parents. And nearly 70% of children under the age of 6 have both parents in the workforce. Currently, we do not have enough childcare slots to serve all of the families that need this care. Childcare is one of the biggest expenses that families face. In addition to the stats you're seeing on the screen, in Colorado, infant care costs nearly 10% more than the average rent. And we're also grappling with staffing shortages, and the ripple effects of those are, among other things, lessening the number of childcare slots that are available. So these are the growing needs that are affecting our families. And on the next slide, we'll look at just how we're working to address those needs. And I get really excited when I look at these pictures, and I hope that they make you smile as well. But just a few months ago, we opened up the Tamara M. Sparks Early Learning Center in our building. Our conference space wasn't getting much use after the pandemic, and so we transformed it into what our community told us they needed, an early learning center. The Mile High United Way headquarters, our building, is located in a childcare desert. And as I mentioned, childcare is very expensive, and infant care in particular is a large family expense. So our childcare center has 2 infant rooms and will have a total of 60 slots for children up to age 5, so 0 through 5. The center will serve families eligible for the Colorado Child Care Assistance Program, or CCAP, as well as our own employees. Up to 15 slots are reserved for our staff members. In the picture on the top left, you'll see a darling little girl in a white dress. Her mother is in the black blazer. That's Alejandra. She's on our evaluation team, and her little one attends our early learning center. Our staff, like Alejandra, get a reduced rate of $250 per month for their children to attend the early learning center. And because teacher pay is a reason we're losing early childhood educators, we are committed to higher teacher pay at our center, paying teachers at least 20% above market rate. The pic on the top right is our beautiful Tamara M. Sparks Early Learning Center. The center is on the same floor as our 211 Help Center. Earlier this year, we reopened walk-in services for folks who don't want to use the phone but may want to meet in person with a navigator. So that service is available for our community. And now families dropping off their children at the center can meet with our navigators to receive additional support for their own education, employment, or basic needs. And then the bottom left, hope is the thing with feathers. This is one of our CEO's favorite quotes and something she shared with us when we learned we were recipients of funding from Mackenzie Scott. With those transformational funds that we received, we invested it in the creation of new early learning centers at 3 partner organizations. Families at these centers will also have access to our 2-on-1 navigators. And we're hopeful that with this model, with this model, how wonderful would it be if we're able to create over 750 early learning slots to support the needs in Colorado, with at least 70% of those being utilized by CCAP eligible families. And then the last picture on this slide, the adorable little graduates of our HIPPY program. HIPPY is Home Instruction for Parents of Preschool Youngsters, HIPPY. This program supports families by empowering parents to prepare their children for success. A parent is their child's first teacher, and our home visitors provide parents with educational tools and resources to support growth and development through weekly in-home meetings. So our HIPPY program and other non-licensed or informal care programs like Family Friend and Neighbor Care or FFN Care supplement the early learning center that we have and the investments that we've made in other early learning centers. And it's really creating a pipeline for early learning educators and supports for families. Marjorie?
Thank you so much, Rowena. And I deeply appreciate that you all have been looking at this, opportunity to expand early care and learning for families in a comprehensive way, right? Not just center-based care or not just, family, friend, and neighbor care, but what are those other referral systems, and also looking at the providers themselves. So thank you for taking that approach. Just one question before we move to Georgia, and that is, what are you seeing in terms of collaborations and partnerships that are really needed for your United Way to be successful?
Oh, thank you for that question. Collaboration is, it's our lifeblood. We couldn't get anything done without collaboration. And so we have key partners working in direct service. We have key partners working on systems change. Our early learning center, we're partnering with one of our longtime early childhood education partners to actually run the early childhood center. And then in the policy space, I think that's where we're really making great inroads. We're working with the governor's office. We're working with our state departments. We have very strong child advocacy groups that we're proud to partner with, like the Colorado Children's Campaign and executives partnering to invest in children. In terms of policy legislation, we've been able to work on legislation that's provided opportunities for employers like us to open up on-site childcare or early learning centers. And it's just another way to increase childcare slots. It's such a great incentive to work at a company that offers that benefit.
That's wonderful. Thank you for that. And I noticed we've got a question in the chat, and that is, how do you integrate HIPPY into your program? And more about family, friend, and neighbor care. Can you just say a little bit more about that?
Yes. So the HIPPY program came first, and so we've been building on that model and refining it to make sure that we're supporting the community needs with that. And now we're shifting to train our HIPPY parents, if they're interested, to become that pipeline of educators within our early childhood space. And we're bringing the HIPPY program to the parents who have their children at our early learning space. And the Family Friend and Neighbor Care initiative in Colorado has been thriving. And we work really closely with those providers who have been supporting our efforts to make sure that we're in alignment with each other when it comes to providing high quality early learning and education for our youngsters, whether families choose to be in a licensed care facility or if they choose to be in family, friend, and neighbor care support. We want to make sure that everybody receives high quality education and support, regardless of where the children are.
Wonderful. Thank you for those details. And again, deeply appreciate the work that you're doing in Colorado. So let's move from a community in Colorado to a community in Georgia, and would love to welcome Jennifer to share the work that you're doing that's contextualizing your community. Where do you see, opportunities and impact? Thank you so much for joining us.
Thank you, Marjorie. Thank you so much for the opportunity to be part of today's conversation. It's great to be able to kick off the Campaign for Grade Level Reading Week with this dynamic group of panelists and some new and familiar faces also in the chat as well. Again, as Marjorie said, I want to begin by talking about the context for our community, painting a picture of where we are in the Chattahoochee Valley. If you're not familiar with our community, we're about 90 minutes, an hour and a half south of Atlanta. Chattahoochee Valley is in west central Georgia. Our United Way serves 9 counties in Georgia, 1 in Alabama. Where I'm located, where Pam and I are both located, is in Columbus. We're actually the second largest city in the state of Georgia, the population around 200,000. Think about those our full 10 counties in our region. We have a lot of variety in terms of population size, scope, and needs as well. Our communities range from 2,500 and very rural to 60,000, and then of course our community. So you think about our full region, and we would say we're a smaller metro size area with a total population of just over 300,000. Our region also includes great wealth and also areas of high poverty and economic distress, including 3 zip codes that are often among the three of the poorest in the state. Our high school graduation rates are strong and have risen in recent years, but early education outcomes continue to be a call for action. We are a community of many strengths and also opportunities. We also have a strong history of coming together to achieve big goals. The goal that Vivian spoke to earlier certainly resonates in our community, as one of our current big community goal is to reduce by half our poverty rate over the next 10 years, and to see that, of course, be sustained in that time as well. So about our history, we don't go back as far as Mile High. Our United Way has been serving our region for just over 70 years. Throughout much of that history, our impact has been primarily through grant funding to local partners, providing essential services, including after school, food and nutrition, safety, healthcare, shelter, and more. In those spaces, of course, you can see that we're supporting both children and their parents. Today, we continue to fund vital programs and work closely with a very strong network of partners. Those partners, I think you'll see, are key in the work of United Way, as we have a strong history in that space and as we're evolving and serving our communities new and differently too. More than a decade ago, we began to lead strategic collective impact work in the area of housing. Our work evolved significantly during that time, increasingly engaging in collaborative partnerships with shared goals. Today, our roles vary and include many that you saw on Iola's slide, including convener, leader, funder, partner, and others, always collaborating with our partners, key stakeholders, and always aligned for impact. Over the past decade, our focus on literacy and early education has significantly increased and deepened. In 2018, we really began to organize our early education work in a different and very intentional way. At that time, our region strategic plan, Columbus 2025, was a key driver in aligning efforts towards shared community goals. And this was a pivotal shift for our organization and across our region. Collectively, we realized that if we wanted to achieve improved financial security and economic mobility in adult years, we needed a very intentional focus on educational outcomes, including during the earliest years of life. This alignment brought in additional partners and increased focus on early education across our community. As we expanded our work, we assessed our stakeholders to identify sectors where we could most effectively reach children and families. So thinking about all the different partners and sectors and groups that we work with, there were many great resources to choose from. Ultimately, we chose to target two key sectors: our early care and education partners and our healthcare partners. These networks and providers, of course, interact frequently from the very beginning of life with parents, have high access, our community, are seen as trusted partners, and have positive relationships with parents. And in their work, they demonstrate care for both adults and children. In the space of early care and education and healthcare partners, we really had some exceptional champions that led the way and exceeded our expectations. Today, both areas continue to be active, innovative, and essential partners in this work. By integrating consistent messaging through trusted partners, we believe that we could achieve one of our very early goals, and that was to increase community awareness of the importance of early language and literacy. In that space, we also leveraged two United Way core stakeholders. Again, that network of United Way nonprofit and community partners that have been vital to our work from the beginning, and our workplace partners. Those are also spaces and places with families and children. In 2019, also as part of Columbus 2025, our community coalition launched the Basics Chattahoochee Valley. At that time, we were the 29th Basics community and the first Basics community in Georgia. If you're not familiar with the Basics is founded on ensuring that all children have a great start in life and includes 5 principles that parents can use every day. These principles could easily be used by partners and parents, and partners could also share them and model them with parents as well. Adopting the Basics was an intentional effort to close the skill gaps between racial, ethnic, and income groups in our community, and to raise achievement levels for all children. As our work in early childhood evolved, we were increasingly focused on key data points for child and youth well-being, and specifically the intersectionality of educational outcomes and poverty. Some of the key data points that were our call to action are those that are very familiar as part of the Campaign for Grade Level Reading, including pre-K enrollment, third grade reading proficiency, ER visits due to asthma, student mobility, and attendance. In 2019, our United Way had a leadership change, and our new CEO had extensive experience with community schools. With our existing work in the areas of education and literacy, and after a very strategic, thorough review, we concluded that the community school strategy was our best path forward to improve outcomes for children, families, and our community. And this marked a transformative approach for our work and community. My colleague Pam Romero will take a deeper dive into our community school strategy and how it has evolved since that time.
Okay, thank you so much, Jennifer, and thank you everyone for joining this webinar today. It's an honor to be here and to share about the work that I have the privilege of leading in our community of the Chattahoochee Valley. Community schools has many definitions, but I'm going to land on community schools is a strategy that transforms schools into places where educators, local community members, families, and students work together to strengthen conditions for student learning and healthy development. As Jennifer mentioned, while the groundwork was laid in 2019, we had a bit of a pause when the earth stood still in 2020. But we were able to launch our first school in fall of 2020, onboarding our first community school coordinator in January of 2021. So we now have 4 community schools, 3 of which are in Muskogee County, which is Columbus, Georgia, and 1 across the river in Phoenix City, Alabama. Full-time community school coordinators are placed in each one of these identified schools to coordinate implementation of the 4 pillars of community schools. And if you're not familiar with what those 4 pillars are, they are integrated student supports, active family and community engagement, and expanded and enriched learning time and opportunities, and collaborative leadership and practices with families at the center of the work. The strategy is a whole child, whole family, whole school, and whole community approach. We monitor success outcomes to include measures associated with student academic achievement, attendance, behavior, increase parent and community engagement, student health, which includes social, emotional, and physical health, effectiveness of services, and school readiness. Community schools works to address each school's unique opportunities, assets, and priorities, all to create positive, sustainable, and transformational impact. Now let's look at the graphic on the screen, and I know it might show up a little bit small for you guys, but this is our roadmap depicting the pipeline services that you find at any of our community schools here in the Chattahoochee Valley. So we've got the school that is at the top, which would really be the center of the work that we implement. So that's families, students, coordinators, the community school coordinator, principals, staff, and partners. And we've also got a pathway connecting all of the core functions of the community school strategy. So if we really start to look at the left, one of the let's see, the first pipeline that we're looking at is high quality early childhood education programs, which many of the co-panelists have spoken about today. Jennifer spoke some about the basics, and this is where we share tools and simple tips to strengthen relationships and support healthy brain development and a love for learning with our youngest learners. We collaborate with community partners serving these age groups through this high quality early childhood education program, such as Early Head Start, quality rated daycares, local churches, community-based health centers, and more to ensure access to books, literacy supports, and whole child supports. And then we continue this work into the school systems by supporting families through that transition into pre-K or kindergarten. We partner with school districts and pre-K learning centers to ensure that messaging is getting out to everyone, but extra intentionality is going into areas that we see low enrollment rates as well as learning gaps. We've shifted our messaging from enroll today to here's why it's a great idea to enroll your student into pre-K or in kindergarten, and included some language around success and positive outcomes. Once we hook parents, we want to ensure that they have all the tools and resources they need to complete registration, such as internet access, digital devices, access to their documents, medical forms, transportation, uniforms, school supplies, and even language supports. So we really want to meet the families where they are and address the greatest needs. We meet the families where they are by going to community events. We could go to grocery stores, barbershops, laundromats, housing authorities, and bring Chromebooks. We bring digital devices with us, copiers, scanners. We also partner with local mobile units such as health and dental vans, vision screenings, and mobile food markets. And we bring translators. So our community has been wonderful with providing opportunities for volunteers to come and help within their community to translate. We also include partner agencies such as those out of school time providers and literacy programs such as the Dolly Parton Imagination Library, so that families have access to these opportunities all in a one-stop shop. And throughout the school year, I mentioned that community school coordinator. The community school coordinator is on site, ensuring that they're keeping their ear to the pulse of the community. While the strategy is informed by school data, comprehensive needs assessments, school improvement plans, and district improvement plans, the coordinator also captures additional input through parent surveys, focus groups, home visits, door-to-door surveying, cold calls, and building and maintaining positive relationships. So we really strive to create a culture and climate that families feel safe and supported in, so that when we need to have tough conversations about attendance or behavior, that the families know that we're leaning in with love and that we are committed to supporting the student and their family by co-creating solutions to address any root causes, whether that be housing, hunger, medical, family, or environmental dynamics. Because we all know that you cannot teach an empty seat. And you also can't teach students that are hungry, sick, tired, or scared. So community schools ensures that services and supports are integrated into the school thread and throughout the day and accessible to all parents. Through strong partnership, we collaborate with school-based health centers, mobile units, local food banks, behavioral health providers, after-school providers, and over 60 community partners providing programs and support services right there in the school building. Many services are available to the entire family, including younger siblings. We have student-centered, parent-centered, and 2-gen programs. And parent voices, most importantly, are represented on the school leadership team. They volunteer and are supported in helping them reach their hopes and dreams. We offer in-school parenting workshops. Classes focus on a variety of topics. We connect parents to GED prep classes, higher ed opportunities, certification programs, jobs or job skills training programs, and address barriers such as access to digital devices, childcare, transportation, and more. We have all seen our greatest success when parents are engaged, and community schools is committed not only to acknowledging those gaps, but also bridging those gaps together with parents and community members.
Truly amazing work and so deeply impressive. Thank you, Jennifer and Pam. And I'd love for Jennifer and Rowena to come onto the screen so we can engage in a Q&A, because there's been a number of questions that are both in the Q&A as well as in the chat. I'm going to ask Emily to help me with a few of them that were in the chat, but let's go to the questions in the Q&A first, because there's a question from Alan Goodman, and his question is, are any of the panelists aware of parenting curriculum offered, required, or did that get answered? It looks like it may have went away quickly. Okay, let me go back to where it was.
Sorry about that, Marjorie. I just was.
Were you answering it?
No, I just was clicking that we were answering it live. Sorry about that.
Oh, okay. So the question is, are any of the panelists aware of parenting curriculum offered or required for high schoolers or freshman college students? What would it take to make parenting classes requisite at the high school or community college level? So anyone aware of those types of parenting classes that are now offered at high school or college? And if it's no, that's okay too. We'll take it as an opportunity. Rowena, in your community?
Other than for our schools that support parenting, pregnant and parenting teens, I haven't heard of any curriculum broader than for that particular population.
Okay, wonderful. Pam, Jennifer, anything in your communities you're aware of? No, I think back in the day that was something that may have been offered in like sex ed classes or home ec classes, those types of classes, but those have since transitioned out of public schooling, I believe, and really held as the responsibility of parents or communities, faith organizations, right? So, but really something worth considering in communities, because as Alan has pointed out, it's very much needed. Okay, now it looks like we have a set of questions for Georgia. Has the United Way of Columbus, Georgia, well, it says Columbus, Georgia, but you're based in Columbus, right? Use the rich African-American, local and state Georgia history to motivate at-risk African-American youth to want to learn, and more specifically to do the hard science of reading, work to learn to read. Any thoughts on how you're connected with the African-American community and using history and culture as inspiration?
Jennifer, do we want to tag team that? So I am, and I'll speak from a I'm gonna call myself an import because I'm originally from New York. So when I moved to Columbus, I'm from New York City, just a little context there, moving into the South, but specifically into Columbus, Georgia. It was part of my mission to learn the history of Columbus, Georgia, and there's such a huge history here. So as an agency, we collaborate with a number of other community partners, and specifically with community schools. We are in high poverty, like areas that we really want to learn the community before we come in and provide the resources or the services that we do through our strategy. So we do a lot of grassroots work. We also partner with the city government. And one of the things that we've recently done was tours. So we bring some of our stakeholders to our community schools so that they can get a feel for what our students experience, whether that's the walk to school and seeing that sidewalks are cracked up or that conditions are not safe for our students. And it brings this awareness and really push for some change within our communities. But in terms of incorporating, I see a question about activities, books, and materials. Another strategy that we have here is called Resilient Chattahoochee Valley. And part of that is it's a statewide initiative, and we are a local cohort. But what we do is build DEI and SEL libraries within all of our schools that we work with, and those within the region. So we've done a lot of work in rural communities too, because going to some of the local libraries, there was not a lot of representation with some of the books that the children had access to. So we built up those libraries, and we're continuing to do so. We have we're leaning into a partnership with Scholastic that actually has some curriculum that is DEI centered. And so those African-American students and Hispanic families, there is curriculum, there are books, there is also curriculum to bring together community to talk about the history of where they live. And let's see. And then our community school coordinator that is within the building, they have a whole resource bank within their room. So they have a resource room that includes books that are accessible to the teachers within the building. They use them with the students when they come in, and parents are also able to check them out. So I hope that answered some of
Yeah,
the
wonderful. And I believe these next two questions are also for you, Pam, and Jennifer, and that is, how do you measure an increase in the awareness of the importance of early language and literacy? And then there's another question about, let's see, what are the qualifications of the community coordinator? So how are you measuring specifically an increase in awareness of the importance of early language and literacy? And then what are the qualifications of the community coordinator?
Pam, I'll start with the first one, and I'll say that was an initial goal, and certainly anytime we're trying to raise awareness, that becomes something that's fairly difficult to measure. We really went back and looked at our partners' utilization of materials and resources by partners, how often they were having sharing that information with parents, what behavior changes might have started from that. I think that the phrasing of that early goal, it was an aligning factor in many cases, and a call to action, and then really being specific, finding ways to be specific in what we're measuring. So growing awareness, partners engaged, outreach, communication, and I think those are not always the easiest things to measure, but finding ways to look at partner engagement, and then hoping that being more strategic in how we transition that awareness or partner engagement and utilization of resources into those improvements and childhood outcomes that we're hoping to see.
Wonderful, thank you.
And then part two, in terms of the community school coordinator, I think what we like to prioritize is someone that is strong at relationship building. the success of our strategy and anything that we do is going to move at the speed of trust, and know that a lot of the parents and communities that we work in, oftentimes there is a lot of trauma, deeply rooted trauma and adverse childhood experiences. So you may be met with resistance sometimes, but being able to de-escalate situations and build relationships. And I think I mentioned earlier is it's not only when things are going bad that you communicate with parents, it's you constantly build those relationships. So in terms of a community school coordinator, yes, we would love someone who knows the community and reflects the community and the school that they represent, and someone that has strong relationship and coordinating skills, because they're not necessarily direct service providers. They're coordinating, they're convening those that are in the community that do what they do best. So that
Wonderful.
is what we look for.
Yeah, wonderful. Thank you. We've got some really great questions in the Q&A, and I'm going to just read off 3 of them. And I would love for Rowena, for you to start, but Jennifer and Pam to also weigh in here. And one is, given demographic realities, how about expanding our work to a 3-generation approach? And then there's also a question about engaging fathers in this work. Since we're talking about parents, it says, why are men absent from this? And then there's another question that was more specifically around how a 2-generation framework supports beyond kindergarten success or readiness. Let me just start off before you go, Rowena, but I'd love for all 3 of you to share, is that at Ascend, we use the term 2-generation approach as homage to the Foundation for Child Development. But in my opening remarks, I shared that we know that family structure is very diverse across this country, and families determine for themselves the structure of that family. Our job as practitioners, systems leaders, and policymakers is to recognize that we are addressing the family as they wish to be addressed. So sometimes it is adult sibling raising their brothers and sisters. Sometimes it's a grandparent. Sometimes there are multiple generations in the family. So recognizing that family structure is really important. But Rowena, I'll turn it over to you for your responses.
Great. Thanks, Marjorie. And I think it's similar at the state of Colorado. Our initiative is called 2Gen, but it really is a multi-generational focus, but a 2Gen because that's what everybody had been calling it at the time. But really it is engaging various generations in interactions with families and making sure that everybody can be successful. In terms of including men, absolutely. Families are shifting and changing. Families are shifting and changing. We're engaging everybody who has a vested interest in the success of a child. And that includes dads, moms, grandparents, aunts, uncles, anybody who's interested. Men are not excluded from our work. We have dads and uncles and grandpas who are very engaged in the lives of the children that they care for, and we want to make sure that they are successful as well. Traditionally, our hippie program has worked with women or those who identify as women, and that is changing now as well, and happily so.
Wonderful. Jennifer, Pam, what would you add to this conversation about the terminology and including fathers?
Well, one, I mean, I guess I could echo Rowena is, I mean, it is a term that it really does include that. I mean, traditional families, and I know within our community, we do see a lot of grandparents, and whether they are the primary caregivers or they're the ones that they are the most active within the school, and the relationship there, they are included in all of these conversations. But as far as dads, I think it's interesting for us because I think in the work of community schools, there is a really good blend of women and men that serve as community school coordinators. For us, we have more men that serve in the capacity of community school coordinators, and they are parents as well. So it is definitely a priority. A good bit of our principals are also men. So there are focus groups that are strictly open to dads. And I mean, they're really strict with that. So it's like you have to be a dad in order to come to this. And it really just creates a safe space for them to talk about some of the challenges that they face being titled sometimes as not being involved in their child's education, and to come up with some solutions for how they're integrated more within the classroom, whether that's volunteering or mentoring or helping to coach after school. But dads are definitely at the forefront with our strategy. They get out there and volunteer in the mornings to help walk the kids to school. And it is just something that we have bled out into the community as well. So there's barbershop talks. There are partnerships with the health district that has dad's program. So I mean, it is certainly a group that is highly engaged and always has a seat at the table.
Wonderful, thank you. And I know there are two very meaty questions in the chat. And
I'm gonna pop in really quick because we just posted our feedback survey. So please, everybody take a minute while you're still engaged in the conversation, and we take your feedback very, very seriously. So please take a 2 minutes and complete our feedback survey. Go ahead.
thank you, Emily. Thank you so much. So just a few minutes before I turn it back over to Bonnie for a close, we've got a couple of really meaty questions in the chat. And that was, one is around language and how sometimes language can be very divisive. And it was in the chat as well as in the Q&A. I just wanted to point to people some resources from the Frameworks Institute that are really important, that get at the heart about how you can have difficult conversations across political differences that get to our broader goals, right? How do you have those conversations? And I think that oftentimes what we're trying to do is be concise, but sometimes people need a richer, deeper conversation. Language really does matter. Words really do matter. And you know, Bonnie mentioned this in the opening. Iola mentioned it as well, as that we're really trying to use language that is more inclusive than not, but we don't want to shy away from making certain that we're always addressing the inequities that have been longstanding. So I didn't know if Vivian or Iola or any of the other you know, panels would like to respond to that question specifically and offer some resources.
Sure. Thank you so much, Marjorie. And this is one that we often encounter in the work that we do. So I appreciate you raising the question. And I'll offer up here what I offered in the Q&A chat is, I think there are several strategies, and I think it requires us to be thoughtful. It requires us to redouble our efforts and not shy away from those difficult conversations that Marjorie mentioned. I think one thing is in terms of the awareness raising that we do, and this is a very common strategy of Local United Ways. You heard it on the call today. In the work that we do across all impact areas, awareness raising is our third most common approach. And so that is fundamental. It's a part and parcel of the work we need to do. And I think a couple things there. One, always framing the work that we do in the context of what we want for everyone. Starting there, starting with what we want to be true in our work specifically here for all families and caregivers and children. And then explaining using disaggregated data, using lived experience, how families are differently situated in their access to resources, networks, supports, and opportunities. So not the outcomes per se, but how we are differently situated and what we have access to in terms of being successful around those shared goals and shared vision for everyone. And then setting, this is the concept of targeted universalism in our work. Setting universal goals. We're not backing away from what we want to be true for everybody in our communities. but we're also setting targeted goals so that we are intentional in our strategies and approaches and in our tracking of progress around also tracking and creating strategies for those who are furthest away from that experience, furthest away from that reality. So that's the concept of targeted universalism. And then thirdly, stressing how equity as an approach benefits everyone in a community. That's really important. Those whose needs are directly served by your programs, your strategies and approaches, and those who are broadly, who live in our community more broadly. And I would highly recommend an article I often share with our network called The Cut Curve Effect, which is by Angela Glover Blackwell. And it sort of uses the cut curved analogy to demonstrate how even when we design interventions and supports with a specific population in mind, that is something that can benefit everyone in the community. So I think we are commiserate to the challenge at hand. And I would encourage us to lean into that and to use some of those strategies. And I'm sure there are others as well.
Thank you so much, Ayla. And Vivian, I would love to have you chime in, but we're now at time. So I do need to turn it back over to Bonnie to do our close. But thank you all for a very rich conversation and resources for our communities. Thank you so much.
Well, and let me say thank you too. I think this kind of sets us up really well for continuing this conversation because I think there were many questions and perspectives that could have been voiced in this time together, but this won't be the end of our time together. You see a lot of virtual applause kind of happening on the screen, and I wish hopefully you all could hear that. I think we had a couple more screens. I just wanted to say that once again, we're going to keep talking about this. Some of you may recall we launched a series last year of 2-generation webinars that looked at 2-generation approaches to alleviating poverty. Stay tuned. We're going to follow that same cadence again in 2024 with a session in September and another one in December.